Here we have two CT scans of the abdomen and pelvis in a patient with non-Hodgkin's lymphoma on chemotherapy. Here is the initial scan and here is the current scan. What we see on the previous scan is a very large nodal mass in the right mid mesentery, and subsequent to chemotherapy, the nodal mass has significantly reduced in size. But if you see the attenuation, on the previous scan, the lymph node was showing relatively homogeneous attenuation, barring a few tiny streaky increased densities and a small area of low attenuation in the posterior and lateral aspect. The current reduced nodal mass shows significant increased uh, density or enhancement, almost filling the whole of the nodal mass, sparing the periphery. So, what is the reason for this? So, when we search the literature, the we do not find many papers for this, but based on review of the literature, I have found following causes for increased density or increased enhancement in the reducing size of the lymph nodes uh, in patients with lymphoma on chemotherapy. The causes include treatment related fibrosis. It may be due to inflammatory response, or it may be due to persistent refractory disease, or it may be due to change in the vascularity of the reducing nodal size. It may be due to vascular occlusion in the lymph node, especially if the patient has got radiotherapy rather than chemotherapy. So these are the few causes I found on search of literature on internet, but I did not find any papers which are looking into multiple cases of lymph nodes which show increased density or enhancement during the course of chemotherapy. I do not think increased density or enhancement in the reducing size lymph nodes indicate a rapid progression or rapid transformation of low grade lymphoma to high grade lymphoma. But it is worth noting this finding on the reports because this is not much described entity in the literature, and we do not know the real clinical significance of it as we do not have many papers or pathological correlation. If somebody knows the good reasons for this apart from what I've mentioned, please put in the comments, and I'm happy to read and respond.